Hello there, this is John Terr. I am President and CEO of the Boulder Chamber, and I welcome you to this industry-specific focus on our restaurant industry as we work our way through this COVID-19 crisis and work to address your needs as a business to get up and operating. I just want to start by thanking you for participating in this session. We are challenged to get our restaurant industry running again as strong as possible and as soon as possible. And so we know that this has been a difficult period for you, and we want to walk through with you make sure we all understand the operating guidelines, but also to get feedback so that we can prepare for the next phase of supporting and getting our restaurant businesses moving. So thank you so much for being a part of that discussion and that effort. I also want to make sure to thank our partner chambers and economic development agencies. All of them have been working together to address your needs. We all have a passion for our local restaurant industry. We all want to see you thriving as soon as possible. So thank you to our partners throughout the county. And then finally, I got to tip my hat and thank our Boulder County public health authorities. They've heard us and understand we have to get our economy rolling again. And clearly getting businesses, our restaurants in particular, up and operating as soon as possible is something that they are working closely with us to do. So I thank them for their partnership in working with our restaurant industry to support their needs. At the same time, making sure that we are protecting public health, because as we all know, if we don't continue to progress in our containment of the COVID virus, we're only going to step back further, and that's going to cause more delay in our business activity. So nobody wants to see that happen. So it's a combination of opening our businesses and getting them running as soon as possible, but doing it in a way that's safe for our business owners, our workforce, and their customers. So how are we going to walk through today's presentation? We're just going to start with just a general sense of where we are in the response to the COVID-19 crisis from a business continuity and business operations perspective, and narrow down on some of the changes just broadly in the stay-at-home, or from the stay-at-home ordinance to the safer-at-home order. We'll then talk about the restaurant industry guidelines, and some of the feedback that you can offer on that will be really helpful as our Boulder County public health officials think through the adjustments that we'll want to make down the road to help get our businesses operating effectively. So it's a partnership. Our businesses, the public health authorities, again, all about making sure that we can get our economy rolling again, but do it in a safe way that protects public health and keeps us moving forward in a positive direction. So with that, I'm going to turn it over to one of the leaders of our partnership. Lane Drager is the Community Mitigation Liaison with Boulder County Public Health, and he's going to help walk us through the program. Take it away, Lane.
Thank you so much, Sean. And thank you so much to the partnership for hosting this and getting this information out to everybody. We really appreciate all the economic development and chambers to make this effort successful. We also really appreciate all of you taking time to engage with us. We know this has been incredibly difficult. The financial impacts of all of this are being felt across every sector. And we know that this is a big deal for the restaurant sector specifically. Today, we're going to be talking about a number of things. Unfortunately, it isn't that you're back to normal business. But Zach, if you'd advance, we'll kind of talk about really what is still allowed right now, how to do it safely. That's a critical piece, that you're still successful in the parts that are allowed. All of our success, as John talked about, hinges on everything continuing to keep our prevention efforts successful. Otherwise, we have that risk of backsliding and having orders become more stringent again. And that's something we absolutely do not want to see. We're really going to focus on resources to support you, not just this webinar, but our website, the tools that we've created, and then an ongoing effort to continue to communicate with folks. The bulk of what we're going to spend time on, though, is really any questions you have. And really want to direct you, if you look at the bottom of the webinar, you'll see a chat and then you'll see a Q&A, and please use the Q&A. That's where we want all those questions, and we can really sort those a lot better. We may be adding some links and resources that are in the chat, and we'll point to those, but we don't want that to get flooded with the questions, and we can manage the Q&A through that Q&A function. So just to make sure you're in the right webinar, because we have so many of them today. And again, thanks for organizing so many chamber partners. But this is for our retail food establishments. We had one for our groceries earlier this morning, but I think moving forward, as we want to engage and keep you updated, we're going to combine all of those folks together. This also would include any of our mobile unit retail food establishments. So I know you're all painfully aware of how long this has been going on and how long it probably will be going on, but we are still under our stay-at-home order in Boulder County. That was extended on the 24th and taking us up to May 8th. In that time, and really recently, we've also added the face covering order. So hopefully this is another aid for businesses, and this is going to require additional steps for our community to take that will hopefully be good in partnership with the specific orders for each of the sectors. This is, again, a long haul. This is what we are going to be seeing for a very long time. We really will not see anything change within our community to some semblance of how it was pre-COVID until we have vaccines. And even then, I think social distancing will still be an important part for people to understand. We see the seasonal impacts of flu and the deaths of that every year. And largely, it's this very similar process of people not taking that responsibility to make sure to stay home when they're sick, wash their hands, give that social distancing. So those pieces are just really critical moving forward. But again, a vaccine is at least a year plus off. So we really will not see effective immunity in our communities for a very long time. And so we really need these next steps to be successful, to start to evolve, to allow patrons back into restaurants, not just where you're at now. So stay at home is in effect until May 9th. And then even after we get to that, it will still be encouraging people to stay home other than for really important needs and getting out to certain businesses, but not back to normal of go out anytime you want. For retail, not the retail food, but retail sales, they have been allowed to do some curbside in the last couple of weeks, and then they will be moving to some more limited access. That takes effect May 9th. But the face covering order is another big piece that is going to be a factor that you should hopefully see as we move forward. So just to kind of talk about that face covering order, this really is effect everywhere in Boulder County, and it applies to anytime people are outside and they're not able to maintain that 6-foot social distancing. So this is really anytime you're out anywhere, you should be prepared to have a face covering on. The exceptions to that are any kind of health condition that could be exacerbated by having a face covering on. So this would, in making it unsafe for people to wear that, then you do not need to have a face covering. Also, children under the age of 12 don't need to do that. And again, when you're able to social distance, you're in your backyard by yourself, there's no need for you to have that. It's really when you're going to be in public spaces. And when we talk about a face covering, we're talking about a do-it-yourself home mask. We're not talking about buying respirators and surgical masks. Those are really reserved for those healthcare settings that really need that kind of resource. There's guidance that we're going to be sharing on how you can make those masks at home, and there's mask drives for people to get that stuff. We will again be continuing on this stay at home as much as possible under the safer at home. So it isn't free for everybody to just go out even with masks on. The various businesses are going to have certain restrictions. Unfortunately for the restaurants, your restrictions are going to stay kind of where they're at right now until we can see more sustained disease suppression and that we have the resources for that ample testing and trace investigations in our community before we can start to move to the next steps. And again, I think it'll be critical to work with this business and thinking through what does it look like to do some of this stuff in your settings, and being innovative where possible so that we can really think about how to make that transition. So at this time, I'd like to hand it over to my colleague, Zach Lustgarten. He's going to be walking you through the specifics for where you're at and then how we're going to move forward.
Hi, everybody. Zach Lustgarten here with Boulder County Public Health. I work in the Food Safety Division alongside Lane. And so the first part I want to start with is what has changed. As Lane mentioned, for restaurant industry at this point, we are still in the same place we were when Public Health Order 2022 came down. So dining in is not allowed under this order. Delivery service, window service, walk-up service, drive-through service, and drive-up service only is what we're looking at as we move forward into Safer at Home May 9th. Just have some signage here that the Chamber and Boulder County Public Health put together along with some other partners. This is a good piece of signage to put up on the outsides of your building. And it kind of goes into the best practices that we're looking at inside of retail food establishments. As you can see, wear disposable gloves when cleaning and disinfecting surfaces. Disinfection should be taking place in these high touch surfaces at an increased frequency. Cleaning and sanitizing of food prep services, as always, in those areas where you're doing food prep, food contact surfaces, those things should be cleaned and sanitized frequently as well. As Lane mentioned, with the face covering requirements, now all patrons that enter the facility, if they are entering the facility for a to-go order or anything of that nature, they should be wearing that face covering along with your staff. Should anyone cough or sneeze, obviously they want to do that with a sleeved arm, using a tissue, and then washing hands. Some other guidelines here, or best practices, would be not sharing cups and eating utensils, avoid touching eyes, mouth, and nose. And then if you feel sick, stay home. And that's probably the most important part here. So we created checklists under Safe at Home and Safer at Home. And I can't speculate what these checklists will evolve to as we move past those. But starting May 9th, we're going into Safer at Home, and that's the direction that these checklists were created under. So I just wanted to be clear about that because we're not sure what the new normal will be when restaurants do open for dine-in service. So the compliance checklist, let's just talk a little bit about compliance. Compliance with the order is mandatory, but the checklist that we've created, that's a voluntary compliance aid tool. It can also be a communication tool for you to your employees and customers, and it will come with a public poster that we'll send out after this webinar. Enforcement of the order. So Boulder County receives violation complaints, things of that nature through our call center. When we do receive anything, the most common of which is business X, Y, or Z is not wearing a mask, I feel at risk, that type of complaint, we're gonna reach out to you and do some education and make sure that you have all the resources you need to be successful under these orders. But one thing that will help us and you is having this checklist in place. So it's a very helpful tool. Should it move past that, I don't foresee that happening, but we do always have the option of closing or civil action. So let's get into the checklist. The checklist, again, this is a tool for Safer at Home, I can't forecast what the future will look like, but these will be different as we move past Safer at Home. So the first thing is having signage on your doors, signage for social distancing, signage for sick folks not entering your facility, and increased hygiene. So the other part, obviously, is closing down all indoor and outdoor seating. we've had a lot of questions come in about outdoor seating, prevention of that, and where your responsibility lies. The general rule of thumb is that if you have a seat, then it could be perceived that you're making it available for folks to stay. So this is curbside and pickup only. So it should be, if folks are coming in to get their food, they get their food and then they go. You can't have folks congregating in large groups outside of your restaurant. So some steps that we've seen that are super effective are having staff outside during peak hours, ushering in new patrons as they leave, limiting access to one door. The more entry points there are, the harder it is to manage. Physical barriers, we're talking about things like plexiglass at the cashier, and then floor markers, both inside and outside of the store, requiring 6-foot distance. Those are going to be effective tools in just prevention of congregation and folks getting too close. And this is a workspaces checklist, so I just want to be clear about that. We have 3 different areas. The next would be for employees. So we're recommending temperature checks and wellness screening. Both of those things are going to go a long way into preventing your location from becoming a hotbed for COVID-19. A lot of folks are asymptomatic, but others, we'll talk a little bit more about what to do in those cases where we have ill employees or suspected. The next thing, gloves and masks. So employees are required to wear face coverings, as Lane said. We're not talking about surgical grade masks here. We want to reserve those for our healthcare facilities. Gloves, obviously, we're always using those with ready-to-eat foods. The addition here would be using gloves when you are interacting with the public. So if you're forward-facing for customers and you're taking cash or even credit cards, you need to be wearing gloves in those situations. Other things, frequent hand washing. We should always be washing our hands anyway, but we want to make sure in these situations that hand washing is occurring, if not more. And hand sanitizers with at least 60% alcohol content are available. Some tools to prevent too many folks from being in the facility at a time would be staggering shifts, necessary personnel only, frequent cleaning and sanitizing of food contact surfaces, and disinfecting of those non-food contact surfaces that are high touch areas like door handles or anything that your hands touch frequently. So I wanted to take a moment here for illness. We've received several calls of folks being concerned about working with someone that was suspected of COVID-19, or maybe that they have it themselves, or the folks that maybe run a restaurant that are fearful of what to do in these situations. So clearly, if you are sick, you need to isolate. Employees who are sick should notify their supervisor and stay home. Those symptoms that we're talking about are pretty well documented at this point. I have a few of them here, but there are certainly more than fever, dry cough, and shortness of breath. There's a link here to how to isolate from the CDC. When ill folks can return to work. These are the 3 criteria that the CDC has come up with. 3 days have passed since the fever has resolved. This is important note that no use of fever-reducing medications can be taken during that time. So we want to make sure that you're not relying on Tylenol or ibuprofen to reduce that fever. Improvement of respiratory symptoms like cough, shortness of breath, those should have improved, and at least 7 days have passed since the symptoms have first appeared. Again, this is general guidance that could be different on an individual basis. Close contacts, this is the piece that I was talking about. A close contact at this point can be as little as 10 minutes in a 6-foot radius of someone who has been suspected of COVID-19, who has actually tested positive for COVID-19, or who has symptoms, or they're getting ill and they might have COVID-19. So those 3 bullet points there. So quarantine, a self-quarantine, should last for 14 days. If at some point during that quarantine symptoms arise and you become ill, then you move into the isolation steps. So the third portion of the checklist is customer checklist. This is things that you can do to prevent illness from customers. And again, it's the signage and markers to promote social distancing, facial coverings. May 9th, that goes into effect that all patrons entering your store should have face coverings. And as of right now, that will go till May 26th when it will be revisited. There should be 5 or fewer patrons in the store at one time. This is a hard one. If you have a very busy to-go situation happening and you have a small area to work within, you really need to make sure that you're not letting more than 5 in the store at a time, especially if you're in a small space. So encourage order ahead, curbside, and delivery options, and then cashless options are always best. So where to go for information? We've just compiled some information here for you. The 2 at the bottom are specific to restaurants. The National Restaurant Association, NRA, as many of you might be members, they've put out a reopening guidance document that you can find very useful. So if you follow this link, the FDA has also put a best practices together with within stay at home, excuse my cat, and safer at home. So working within those parameters. And now we just want to open it up to Q&A.
Great, thanks, Zach. All right. People want to know when dine-in is possibly going to resume.
I can either take that or Lane, but yeah, so it's uncertain. And really it depends on how well safer at home works. The state will revisit right around that same date of May 26th, what comes next. So dine-in options at this point, we can't speak to a specific date, but I would assume based on the state's revisiting of what the next phases are and how effective safer at home is, would be May 26th for consideration.
Lane, did you want to add anything, or are we?
No, it's really dependent on the success of what happens in this current phase. So if we see sustained increases in disease beyond what we're expecting by the increase in testing, it could hamper that implementation time. I think it's also going to be really important to work with this group in thinking through what that really looks like. How can you manage the risks of having people inside a closed space, not wearing masks, obviously, while they're eating. And so really thinking through all those really challenging pieces and becoming innovative of how do we really address this. So that's the opportunity of thinking through with this group. What does that look like? That being said, we are under the state's orders. So we are trying to create a good feedback loop. That does not mean the state will take any of your feedback and change things based on that. But where we have all of our flexibility, we want to know that so that we can really be as nimble as possible.
So kind of 2 follow-up questions to that. Ling, could you go into a little bit more detail about what metrics are you or the state or CDPHE using to measure the success in combating the virus to be able to move to next phases?
Yeah, we've got several data points that we're looking at, not just specifically how many people are sick. Really the whole effort of this public health order and then stay at home and then starting to relax them is a management of our healthcare system so that it doesn't become overwhelmed. So there's a certain maximum amount of patients that are hospitalized and then using critical infrastructure that the system can handle. And so that's really the bigger numbers are those hospitalizations and those critical care patients, not just the overall number of people who are sick. Because once the healthcare system is overwhelmed, we now see any reason that you would need to go to the hospital for an urgent care is going to compromise your health because the system no longer has capacity to handle anything more. So that is the whole reason for all of these orders. So again, we'll be looking most specifically at that infrastructure within our healthcare system for those hospitalizations and the critical care of those highly ill people, not just people who are sick who can manage it at home. That's probably the biggest indicator. The other big components are our infrastructure to do robust testing to make sure we really are identifying as many sick people as we can, and then isolating them and quarantining those close contacts. So that is a critical piece. And if that infrastructure is still not as robust as it needs to, or we can really identify and keep sick people out of the general population, we won't be able to relax orders. So that infrastructure, and then again, our staffing capability of handling all of those trace investigations, which again is going to take an incredible, huge ramp up, which we've actively been doing now. But again, it's still something that the system's capacity is really just not there.
How much notice are you anticipating we will be given before dining customers will be allowed?
Another great question. That's been a constant feedback from locals up to the state, is that we need to be working in concert together. We need to have information well developed before we roll out orders and changes, versus changes in orders, then figuring out the guidance and then suddenly implementing them. So we've been pushing very hard to flip how things are happening now. So that's our hope. We don't know for sure that will happen, but we intend to work with you closely so that we feel like we have a lot of the answers and are going to be feeding up when we believe we can move to the next stages to relax orders. So again, I think from moving forward, we hope to have a lot closer communication so people feel like they're not surprised with anything.
And this group has a regular meeting time. We've set up weekly, Tuesday at 1 o'clock. Thank you, Zach, like on demand there. Tuesdays at 1 o'clock, there'll be a regular time for additional information, questions, but also gathering that feedback that Lane is talking about for the future. There's a question as to what you're seeing across the country as far as restaurants creating social distancing, reducing capacity. Are there some best practices that you're looking into when researching this?
Well, I'll tell you what, things are varied across the country. We have, for example, Georgia reopening dining right now. And we're seeing their guidance come out, which is helpful as we push forward in the next weeks and months ahead. But as far as best practices go across the country, the best resources that I've seen as far as how to operate safely now and into the future would be from the CDC. And they have interim guidance, and we'll have that in the webinar links, and the FDA. And that's the most useful information that I've seen. We, like I said, as things are reopening with some of our southern states, we are seeing some guidance come out of there that obviously we need to look at and see if it'll work for us moving forward.
I think you're going to likely expect to look at your dining areas, and those would need to be rearranged so that you can, at a minimum, have social distancing between dining parties. Thinking about how would you deliver food? Would that be people going to pick it up? Really minimizing traffic so people aren't bumping up against other tables as they move to a bathroom. So really how you control the flow of people throughout your business to try and maintain social distancing, not have tons of people in the bathroom at the same time. A lot of the issues also that I think are going to be difficult to sort out in some of the office settings that are starting to open up right now. Right now they're at maximum 50% capacity. So already planning on that, but also then thinking and where you can further minimize it. So a lot of those pieces that we're starting with some of the business sector and seeing how successful those practices are, and then where they are successful, working those into other sectors. But again, I think certainly your thoughts on how you feel you can best set things up will be important. And I think you'll need some kind of real clear plan on how you're going to address these pieces.
So Lane, this is kind of directed at you. No restaurant can survive at 50% occupancy, and you're saying that the vaccine is at least a year away. Are you saying that restaurants will have a 0 to 50% business over the next year?
I don't know if it'll stay at that. That's kind of the first phase in the office settings. I would certainly expect something similar for the next phase of restaurants. I don't know that that would mean it would stay there for over a year. Again, I think it's all these factors of what's happening within our community, how successful are people at really managing social distancing, how effective are restaurants. I really struggle to see full occupancy now where tables are upon tables and all patrons are within a foot of each other, nobody wearing masks. I really honestly don't see that level happening, certainly anytime soon. Again, I think those are just those pieces of thinking through how would you pack in a bunch of people into your restaurant and still protect against the risk of COVID. You know, they're the competing interests that it's a real no-win situation is what we've really been talking to people about is how do you allow businesses to be fully successful at the same time, how do you prevent this disease from spreading when it's spread person to person? So, you know, there's no way to win on both fronts. You can certainly do all the prevention by locking everything down. We've done that, and we still see obviously disease happening in the community. So you can imagine as you relax things to a point where you're not doing anything, you get widespread disease. So I don't know that again, the answer's long term, but I know that there will be restrictions of some kind, likely for a very long time.
Do you expect Boulder County to follow state orders throughout the process on reopening, or will Boulder file for exemptions like Mesa or Eagle County?
Given the proximity of the metro area, we're so interlinked with what's happening within disease within the other communities. I think, you know, Eagle County and Mesa are a lot more isolated. We know we have workers that live in one county, work in another county. Their kids might go to school in even another county. So we're very interlinked with what's happening within disease transmission within the metro area. That's one of the reasons there's been a huge effort to be consistent. That being said, if we really believe that we have some way to isolate things more, we certainly could look to that, but it's unlikely we would be ever less stringent than the state, given again, all the conditions that are happening within the metro area. If all the metro area is doing great and the rest of the state is not, and that's why the state is being stringent, I think we would pursue ways to be less stringent.
Okay, Zach, you covered a couple potential physical barriers that may be necessary. Someone would like to know if there are any sort of physical barrier requirements that may be in place when they open up, what they might be, just kind of in the planning phases, especially as equipment's becoming less and less available.
Yeah, again, we can look towards our states that are creating this guidance now. From what I've seen, as far as physical barriers go, we'd be talking about the cash register situation for the most part. I don't foresee a way that there would be a physical barrier between a server and a customer or anything of that nature. What we're talking about with the physical barrier is currently a little bit easier with the to-go and carry-out. No, it's something that we need to workshop, and we need to some assistance with coming up with that kind of information.
Currently, retail establishments will need some sort of, you know, barrier between themselves and the guest that's paying. Do you foresee that there's a potential of something like a plexiglass, kind of like what retail's facing?
So again, I don't think that that's in the order. That's a recommendation under the checklist. Yeah, I think that we'll look at our other sectors and see what's working, and utilize those practices that, you know, from our lessons learned.
All right. A little bit more specific, with the limiting of use to one door only, aren't we in a violation of fire codes in place?
I don't think that's an issue. I mean, we're talking about restricting flow within facilities, not to say that you're somehow disabling a fire exit, that you should already have adequate exits in order to have complied with the fire codes. We're just talking about flow. So that doesn't mean in the event of an emergency, you wouldn't still use all your emergency exits.
And to follow up on that, there's a question that came in via the chat, so I'm trying to look into both places, that said they missed the part about something you said about 5 patrons in a restaurant at a time. How does that apply? What did you, what's the clarification on that?
Yeah, under safe at home and safer at home, we should be limiting the number of folks that are entering the facility. And 5 is the recommendation that was provided in the frequently asked questions portion of the state's guidance that went along with Public Health Order 2022.
Okay. Do you have a place to get information for school cafeterias and summer camp programs?
As far as school cafeterias, I'm not sure the specific question they're looking at, since schools right now are on remote learning. So if there's other operations of that, they can definitely reach out so we can talk through what they're thinking there. For camps, we've been waiting for quite a long time for state guidance on that. I think our best information to share is that we believe those should fall under the current childcare guidance, which talks about 10 children or per kind of class, or at least classroom. And if there's multiple rooms, then you can have multiple people, you can up to 10 per classroom. But there's a lot of stringent guidance on what the child cares need to do, how drop-off works, screening, all that sort of stuff, the frequent cleanings. So that's what we are intending to move forward, barring hearing something different from the state. But again, we have yet to see any guidance on camps from the state.
Okay, so one person said our restaurant is near a big park with the limit of 10 people gathering. How big is the space that includes the 10 people? Is there square footage that encompasses the 10 people so that another 10 people can coexist?
For public spaces, obviously at a park or something like that, there isn't an occupancy of 10 for the entire park. We're really looking at gatherings. So people need to still social distance, even if they want to go. Again, if they're not from the same household, they still should be social distancing by 6 feet. So you shouldn't still have a group of 10 people all sitting together on a blanket eating. That's not compliant with the safer at home efforts. But again, for public spaces like parks, people just need to practice social distancing. There's not occupancy numbers being issued to parks. It's just for people to practice social distancing. So again, those specific households are separating from other groups. I would certainly say if you know that people are leaving your restaurant and just going right next door and camping out to eat, I would encourage that you're kind of a part of that, I guess, because they're all coming to get your food and then eat it over here. Really make sure that you're mentioning those things. Hey, don't all go hang out in the park over here. You still need to practice your social distancing, because it could somehow get back to you if you're the contributing factor of why everybody's gathering in that park. So certainly do not want to impact your business and have it not be successful. But we know that those are concerns, and certainly when they're off your property, it's not for you to manage that. You can just be a tool to help try to alleviate a problem.
So this question is, will you also cover mobile units in this presentation, or is the guidance already in the checklist?
Yeah, so the thing with mobile units is they don't have a dining room. So it's kind of business as usual when they're in the field. Now, all food should be prepared in advance or have advanced prep done at a commissary. And in those situations, strict social distancing of employees. But the guidance does not cover anything specific to mobiles other than just social distancing requirements. And so a lot of that can be accomplished through signage on the mobile unit. And again, just like Lane said, you know, I suppose just not encouraging folks to congregate in front of the mobile or near.
Okay. So we have a question. One person said they have a big concern on a particular part of Boulder regarding large groups of transients gathered outside of the restaurant, putting others at risk, not social distancing. What, if anything, do you suggest we as a restaurant do to help the situation? Also, are there city guidelines in place regarding handling this type of situation?
You know, we have the call center for any kind of complaints. That's the vehicle to share that kind of information. We are working with our attorneys and law enforcement for enforcement of violations of the order. So that would be the mechanism to try to address those things. And we know there are certain areas that are already being investigated and potentially moving forward with enforcement.
Are face shields acceptable versus a mask?
No. A face shield does not satisfy the mask covering for that tight covering on a face.
Okay. Do you anticipate bar stools needing to be spaced out 6 feet into the future?
We do. I think that that's a reasonable expectation. I do think that bars are going to be a very difficult area to enforce social distancing without having bar stools removed at least 6 feet apart.
All right, another technical one, Zach. Can I scoop and serve gelato from my mobile cart for ready to eat, or do I need to package it to take away to dissuade groups gathering, like add lids?
Sorry, I was muted. Can you repeat the question one more time?
So the question was, they scoop and serve gelato from a mobile cart for ready to eat.
Mm-hmm.
Do they need to package it for takeaway to dissuade group gatherings, like adding a lid to it?
I don't think so. I just think that you need to have the signage and you need to be clear with the message of not congregating. I just don't think that that's necessary. And Lane, you may want to weigh in on that as well, but.
No, I fully agree. Really the scooping, they just need to make sure they have hand washing for themselves if they're not selling prepackaged kind of stuff. And it's really just incumbent on people to adhere to the orders for their own social distancing.
Okay. I own a catering company. Many of the venues we work at are outdoors. How will the number of guests allowed to attend events at these types of locations be determined?
Currently, 10 is the capacity for all events. That likely will not be changing until the next iteration of a next phase. So events more than 10 people won't be occurring.
And then there's questions about, most likely there'll be group size restrictions into the near future for restaurants reopening for dine-in and private events.
Yeah, again, that we're not at that phase yet. I think the maximum you would expect is a 50% occupancy of what you're currently at. But again, that's when we're starting to allow gatherings over 10 people. So as well as having people without masks be in confined spaces inside restaurants. So there's a lot of components to that, but we're not at that stage yet.
So one of the questions was, how will face covering requirements work in a dine-in when you have to remove them to eat? And that's one of the things you want to discuss as we move forward, because that's one of the things that needs to be thought about before the next stages are perceived.
Yeah, I think it again shows that there are certain things within our kind of world, our business world, that are much higher risk. When we look at different services right now, not all services are reopening. You know, if your job is to give facials, people are not going to be able to wear a face covering and still get a facial. So that business can't do its job right now. That is not allowed. So I think those are the challenges are once we're removing different barriers in different parts of our efforts to prevent disease, can we actually do it and not see significant increase in disease? You know, the hard part is people don't always follow the directions. When they're sick, they don't stay home. They potentially still go out. They still might want to go out to eat. And that's the challenge that we're up against. And sometimes people are not that symptomatic, but still can spread disease, especially without having masks on. So those are the risks that we're balancing with all these decision points.
This kind of leads to that next question. What is the expectation of restaurants when it comes to customers wearing masks? Will there be enforcement and fines on restaurants for serving customers who do not have masks?
Oh, you muted yourself.
Zach, you're on mute.
Sorry. I apologize. So can you hear me?
Yes.
Okay. So I can only speak to where we're at right now. We're not in a dine-in situation at this point, and facial coverings are required as of May 9th through May 26th, at which point it'll be revisited. So yes, it's perfectly reasonable to not allow someone in. You have that right if they're not wearing a facial covering, but it is important to note that there are exceptions to needing to wear that. So be aware of that. Ask the question and kind of leave it there if they're pointing to one of those exceptions as to why they don't have a facial covering on. And I think it's too hard to speculate like what the next phase will look like.
And 2 points, Lane, can you talk about some of the populations that may not wear a mask because of, and it's allowed in that order?
Yeah, the order specifically calls out children 12 and under not needing to wear a face covering. And also anyone whose health would be compromised because of wearing the mask. So, and that's very broad. And so that would be the piece is, certainly verifying, hey, do you have any condition that prevents you from wearing a mask? And if they say yes, that sort of ends that. So you can't continue to probe them and find out why they need to be mask free. So that's I think an important piece. So there will be people that are not able to wear a mask.
When a customer doesn't have a face mask and we inform them that masks are required, they will sometimes just pull up their shirt to cover their nose and mouth. Provided they keep their faces covered in this way the whole time they're at the shop, is this type of covering adequate?
No, I would say no, that's not. They need a face covering. And so just temporarily putting your shirt over there is not adequate.
And then it might be good for potentially Lane for you to clarify that Boulder County, again, is following the state of Colorado rules. So if one business is farther ahead than another, you're not able to just allow them to open. And the county is following the state.
Correct. We're following the state's requirements. I think, and I'm not sure the scenario of one restaurant being further ahead. This is really based on kind of population health of the restrictions. So again, one restaurant having, say, more capacity to separate people is not the reason why they would get to open or not. It's really the risk within the community of having people dining there with no masks on.
And then one other piece, just to let everybody know, is that some of the signage that you'll receive as resources, including the face mask required, do not enter if you're sick, things that you can put out that look, that are from the community that you can put up that will be consistent across businesses to help you in making that education case. Another thing that we'll send is a sample script that talks about how to talk to somebody about face coverings. That is available from Boulder County. And then thank you, Zach, for putting up the call center phone number again. That was one of the questions. So there's the call center number and the email address. You can call or email that. I'll also send it into the email. I think we have a question. Do we have any obligation to let someone in because they can't wear a mask? Are we allowed to not serve them because they can't? Just a follow-up, Lane, on that other piece.
No, for people who have a health condition that prevents them from wearing a mask, you cannot discriminate against them for that. It would be similar to other ADA pieces. So again, will people abuse that? We certainly hope not. But that would be the piece, is that it's important that they declare, yeah, I'm unable to wear a mask. I have a health condition, whether that's even a mental health condition that would be exacerbated by feeling constricted or stressing and straining them. Those would all qualify under reasons why people cannot wear a mask safely.
Okay. A couple more questions. Given what we know about transmission through the air, are there any thoughts about what might be expected related to ventilation or other requirements?
I don't know that there's going to be new ventilation requirements for businesses, like that they need to install additional equipment. I think it's critical that their ventilation system is adequate right now, that it's operating the way it's supposed to. But we don't necessarily foresee that businesses are going to need to retrofit their ventilation systems, adding specific types of filtration and things like that. The greatest risk is person-to-person airborne transmission. It's certainly possible for airborne particles, but we're really talking more about droplets rather than a straight airborne, where these things stay suspended for days and days and can be blown through systems for that long of a time. So that person-to-person droplet is the big risk that we're trying to address. It's not like measles or other diseases that have a much different airborne transmission, where everybody in a room can now be exposed because one person is sick.
Okay, I'm going to do two more. Is there anything a restaurant can do to be more proactive and demonstrate we are prepared to reopen for in-person dining? Already prepared checklists, flow inside, removing tables, and so forth.
Certainly that, I think those are great steps. Zach, I don't know if you have other pieces to add, but really I think the pieces of this are when is it going to be safe to even move to these steps? I don't think a business can fast track themselves to suddenly open when we're not at that stage. That being said, we will certainly communicate our thoughts on what we expect this to look like, so businesses are ready. If there's other, again, if plexiglass seems to be something that is likely going to be a component, even though it's not right now for your to-go delivery. So we don't necessarily think that is where it goes, but if it is, we would want to make you prepared so you could start getting yourselves retrofitted. But right now we don't have that list of the things that you need to do to be ready.
Yeah, I think I would just add to that some things that I have a gut feeling are coming, and some suggestions. Again, we're not there, but this is some things, or some of the items that I think would be helpful. Number one, pre-wrapped silverware. Okay. Two would be single-use paper articles such as menus, things like that, that could be discarded after each party. Obviously, we probably want to do away with refills or any kind of reusing of a customer drink or customer plate, or so that also goes to hot and cold buffets. We would foresee, I would have a gut feeling that that a customer self-service of any sort, specifically like those buffets, would be disallowed under those next phases. Those are the big ones for me moving forward.
Okay. No, I didn't get to all of your questions. There's one last one. It's about 5 of the questions, and that is where they can find more information on hospital utilization and IC utilization information. As you indicated earlier, Lane, that's one of the metrics.
I know we're showing, and I think the state is as well, of current hospitalizations. I don't know if it's going to share ventilator usage and things like that. But our Boulder County website, I think we have links to bouldercounty.org. There are different links within that page that get to information that's being shared publicly. So I know we're tracking obviously the overall cases, how many cases we're receiving by days, hospitalizations. Certainly with internal, we are looking at a lot more resources than that. Each hospital is being tracked for what their ICU capacities are, what their ventilators, all that sort of stuff. So, and I guess just one other thought for people is, we certainly know what the capacity is. There are efforts to look at potential surge needs. But again, if you're looking at that and saying, all right, if we fill up all these beds with COVID people, that should be all right. Just know that you have no beds left for anyone else with any kind of critical care. You have a heart attack, you have a this, you have a that. If all the beds are filled with COVID, there's no bed for you when you need it for some other critical piece. So that's the system when the system is overwhelmed, if we filled up all the beds for just COVID. So knowing that that's the thing that we need to avoid. Otherwise, the death toll from other things that potentially could have been prevented will increase beyond just what happens with COVID.
Thanks, Lane. Zach, in the chat, put a link to the data, the Boulder County data that is being tracked and put out there to the public. We're going to have to wrap up because we have another session starting at 3, but this group will meet weekly at 1 o'clock on Tuesdays. Keep those questions coming. There's the call center information, and we'll send out an email with the resources. So John, for a quick wrap up.
Yeah, my quick wrap up is I just probably, as all of you feel, I mean, we've done a number of these education and feedback sessions, and this one is the most frustrating, and it's because of the nature of the restaurant business. And so clearly, you know, when Zach and Lane lay out the conditions, it's not something that I know that they're happy about. It's just they're doing their job to try to protect public health. But our work with you, the restaurants, is to make sure that we are thinking strategically about how do we both protect public health, but also get your businesses operating as much as we can, as soon as we can. So this dialogue is critical, and I thank the public health officials for entertaining that and for being available for other input. Make sure as you have ideas, submit it to that website right there, that web address. Also reach out to your local chamber, including the Boulder Chamber. So thank you to our chambers and our economic development associations for working together to put these together. Thank you for Boulder Public Health for being a partner in this public health and business issue. And thank you all for being here and being a part of this important dialogue. Look forward to working with you throughout this crisis to get your businesses back up and running as soon as we possibly can.
Thank you.